Hello, my sugar-coated stethoscope sniffers. Welcome back to the Villain's Clinic, the only place where failure is fabulous and heart attacks are served hot and dramatic. Today's episode? Acute Heart Failure. Or as I call it when your heart goes, I'm done being emotionally available. Knock knock. Who's there? Cardiogenic shock. Cardiogenic shock who? Cardiogenic shock you if you don't sit down and pay attention. Acute heart failure, aka the drama queen of cardiovascular emergencies, is a life-threatening, chest-clutching, breath-stealing, dignity-snatching event. The heart fails because of structural or functional problems, like a medical student on their third Red Bull, that it was triggered by acute coronary syndrome, hypertensive crises, arrhythmias, and valvular messes. The signs as fluid congestion, weight gain, and orthopnea. You know, just girly things. Are you pulmonary edema? Because I can't breathe when I'm around you. Let's play a fun game of what body part is crying today. Let's CSI this corpse in waiting. IV loop diuretics. Flush out the drama. Oxygen. But only if SATs are lower than my standards. Even morphines like, I don't vibe with you anymore. Inotropes like dobutamine. Motivational speech for your LV. Vasopressors, because sometimes love isn't enough to raise the pressure. Opiates, once cool, now controversial. Beta blockers and ACE inhibitors continue unless the patient's heart rate is slower than your DMs after an OSCE. And that, my breathless little disasters, is acute heart failure. The moment when your heart finally goes, I can't even dumper. Comment below with your favourite symptom and subscribe for weekly episodes of Medical Madness. And always, I shall roast 3 comments. Until next time, don't go into shock, unless it's from how good I look in a lab coat. Bye.